guys, Dr. Eric Smith from Optimal Health Chiropractic in downtown Chicago. So we do a lot of weight loss and body composition help with patients here in the office, and that's either to lose fat or to gain muscle. So today we're going to talk about one of the biggest things that people have trouble with. It's losing that fat around that midsection, that stomach fat that seems to never go away. Or a lot of people say things like, "Oh, doc, it's the last thing that'll actually go away, but that's the first thing I want." And so I'm going to demonstrate actually why that area of the body is a lot harder to get rid of the fat, or so it seems. So basically, in this area of the body, you obviously have your skin. Then below that is your stomach and other organs, such as your intestines. So your intestines are over 20 feet long. And if you think about piping this 20 feet long, if it's really thin, it's going to be able to be compressed a little bit better. But as it gets bigger, or if it thickens or has gas in like that tubing, that expands and contracts, as well as you get that full feeling when you eat a lot of food. So I'm going to demonstrate kind of what happens if you think of this as your intestines, say 20 feet long. Well, what happens if you start eating poorly over the years, or you're eating some food you might be intolerant to, or maybe even allergic to? It's going to kind of expand. So think of this balloon as kind of that area of your stomach and just the overall area. So now it's expanded a lot. So over this time too, you're probably, since you're eating poorly, you're gaining a lot of fat. So Morgan's going to demonstrate, put some shaving cream on here, which is going to help us really demonstrate what's going on and show what fat looks like on top of your layer. So you may have some fat around and in the organs. That's what we call visceral fat. And the fat outside is what a lot of people want to get rid of. So as you have your stomach and such that is now distended, and all these other organs like your intestines are inflamed and such, now as you get to the right diet or something that's working for you, working with a doctor or coach along sorts, or maybe even doing like our ChiroWithin program, you'll find that your inflammation and the gut lining will actually start to go back to its normal size, which you see with the retreat of the air here. But what happens is you notice that per that surface area, there's a lot more fat in that, because the surface area went down, but the fat hasn't gone away as quickly as the inflammation and such has. So you end up with what looks like a lot more fat, and it looks like it's going to go away last. It's really not. There's not a way to spot train fat away. You can't diet a certain area away directly. The body really goes for fat in a more global and all around area. But if you wanted to understand why it's hard to lose that fat, the biggest things you got to do is be patient, be consistent, and also give yourself some time and understand that it's not that you've just accumulated it all right there, but it's literally that you're healing yourself from the inside, and it'll show on the outside. If you have any questions about how this works or how we might be able to help you, feel free to comment below or give our office a call.